So our next person up is Bayrouti. He is one of our 2 Calgary Med students, spending a year with us as part of the Community Engaged Learning Program. Kayla here is our other student. This year they've done a wonderful job interviewing the members, building an informational poster project, which unfortunately didn't get printed in time. You can not find it at the side of the stage. Ali is going to, I hope, speak about his experience this year.
A little bit taller, sorry. Awesome. Hello everybody, my name is Ali Bayrouti, and it's an absolute honor to be here today as we recognize Neuropathy Awareness Day. I'm very excited to be here, particularly as we bring visibility and understanding to those who are living with neuropathic conditions across our province and beyond. So before starting medical school, I'm actually a registered nurse, and I worked across the province in various different areas, all the way up north in High Prairie, Grand Prairie, all the way down to the southeast border of Oyen, in very remote and isolated communities. And one of the most consistent things that I noticed, especially when working with seniors, was the persistent problem of neuropathy, no pain medications that actually do work for them, and no availability to supports. They could go to their family doctors and get medicine, they could go to their pharmacy and get medications, but beyond that, there wasn't really any options, nor was there anything for complementary medicine or alternative medicines, or even allied medicine and healthcare. That's why when I had an option of picking what community elective I wanted to do, I ranked the Neuropathy Association as my #1 choice, and I was very happy to be placed there. So this year, I had the privilege of working closely with the CNA under the amazing leadership of Linda and Sylvia. Thank you for all your hard work and the entire organizing team who made today possible. I've worked with a lot of different community organizations over the years, and I've never met 2 more passionate individuals than these 2. So I'm super grateful, and it's just so inspiring and amazing to see the work that you guys do and the community that you guys bring together. So I wanted to start off by saying thank you. Through my experiences as a nurse, I witnessed the physical impacts of daily living caused by neuropathy, particularly diabetic neuropathy, and the associated complications. My time with the CNA as a medical student has provided a new perspective with deepened understanding because I had the option to listen to the stories that people were sharing. I attended educational sessions and performed patient-focused interviews exploring the first-hand experiences of those living with neuropathy. Together with a fellow medical student, Kayla, we compiled these interviews and we performed a thematic analysis of our interview findings, which we eventually will be presenting as a research poster. We just don't have it printed here today. In addition, I also developed evidence-based patient-focused educational materials for the association's online medical library with a goal to empower patients to understand their conditions and promote self-management. The stories I heard during our interviews taught me that medicine is as much about listening as it is about treating. Many have navigated years of uncertainty, misdiagnosis, or isolation before finally finding answers, or even simply validation, which for some was enough. For many, neuropathic changes affect how they move, walk, sleep, or interact with the world. Yet, despite how common it is, neuropathy remains under-recognized, underdiagnosed, and undertreated. That's what makes today so important. Awareness is not just about knowledge, it's about recognition. It's about seeing the individuals behind the disease and the conditions and ensuring that they are supported by a healthcare system and a community that understands their needs. And without listening to them, we can't understand those needs. Events like this remind us that healthcare extends beyond hospitals and clinics. It lives within community organizations, in advocacy groups, and in the connections formed between people who refuse to be defined by their diagnosis. The Calgary Neuropathy Association embodies this. It provides education, support, and hope, bridging the gap between patients, clinicians, and researchers, as we saw today. As a future physician, I see Neuropathy Awareness Day not only as a call for recognition, but as a call to action. to continue educating ourselves about neuropathic disorders, to advocate for earlier detection and equitable access to care across the province, and to bring a voice and awareness to invisible disability. Today is a reminder to approach every patient encounter with empathy and curiosity, because even when we can't cure, we can listen, believe, and support. In reflecting, I've come to appreciate how much progress has been made through this organization. Through research, multidisciplinary collaboration, and community-driven advocacy, advances in early detection, pain management, and regenerative therapies, which you guys saw earlier, are giving patients more options than ever before. But progress doesn't happen in isolation. It happens because people share their experiences, clinicians stay curious, and organizations like the CNA continue to lead with purpose. Neuropathy Awareness Day is a reminder that while science drives innovation, compassion drives change. The more we bridge the two, the technical and the human, the closer we come to ensuring that every person affected by neuropathy receives care, and care that's not only effective, but empathetic and personalized. To wrap up, to everyone living with neuropathy, thank you for sharing your stories, your strength, and your trust. You remind us that awareness leads to understanding, and understanding leads to change. Thank you.